Singapore has been very fortunate throughout the COVID-19 pandemic, and this exit plan is an example of how carefully thought through the COVID-19 restrictions and forward thinking that the government has exhibited. So while at the moment we may be facing certain restrictions, we are looking forward to a move from pandemic to endemic. And this means that we will be looking at increased vaccination rates and a certain degree of freedom in terms of large group gatherings as well as activities, and of course looking forward to travel across borders.
Wow, so much to look forward to there. Why has Singapore chosen the 80% as the vaccination target? Can it be achieved by September, do you think?
I am absolutely certain that we will be able to get to the 80% or even higher vaccination mark for the population of Singapore. As you know, this is a relatively small island nation, and we are in a very close-knit community that cares for one another, and vaccinations are freely available on the island, so easily accessible. Now, when it comes to the number 80%, we also know that this is evidence-based. It's based on an understanding of the effectiveness of the vaccines throughout the various types that we see. There's going to be continued evidence gathering and understanding of both the vaccines as well as the types of coronavirus, COVID-19 virus out there. So it's going to be evolving, but I believe 80% is certainly achievable.
Tell us a bit more about how different life will be come September. At the moment, when you have outbreaks of COVID, how are they dealt with? And do you think that lockdowns from come September will no longer exist?
I don't know about the September mark because as COVID has taught us, certain timelines do tend to shift. But what we call it here in Singapore is phase 2 heightened alert. And so that means that certain levers can be turned on and off depending on the situation. What we're looking at right now is an understanding of how the virus is affecting individuals, whether they are vaccinated or not. And so we know that vaccines will be able to help protect people from severe illness, making sure that they're not hospitalized and requiring intensive care. When we think about how we exit out of a phase 2 heightened alert, or as some other places might call lockdown, we're looking at the ability to go to the gym again, to be able to enjoy going to restaurants again. And those are all hinging upon what's very important is vaccination. And at that point, we're looking at more of the care happening at home. There's testing, there's quarantine, there's recuperation from the effects of the disease at home. And so when we get to that point, we will be able to see less of that movement out of our homes into community centers, into hospitals. And I think that will be very good for the population's mental health.
What would you credit Singapore's success with? Is it the relatively smooth rollout of the vaccine program so far, do you think? And also, there hasn't really been that hesitancy among those living in Singapore to get vaccinated. Is that right?
Well, we have seen a little bit of hesitance with the older population, particularly those over 70. And so currently some of the messaging and the community outreach would be for that older age group who are at higher risk. And so I would urge any of you who's listening to this now, the vaccinations can help you no matter what age group you're in. And in terms of the success of the vaccination rollout here in Singapore, at the very beginning, it was a little bit slower than many of us would have liked, but that was because of supply. Now that supply is no longer an issue, the government has set up vaccination centers all over the island at community centers and all sorts of places. They're even going to homes to vaccinate those who are not as able to be mobile. And at the same time, they have this amazing digital platform that we all use to be able to book our appointments. So as an example, when you want a vaccination, you register, you receive a mobile text message, you can click on a link and immediately be able to book at your earliest convenience, at your most convenient location. I really think that this pandemic has taught us the importance of digital health tools like that.
Indeed. At the moment, how restricted is travel in and out of Singapore, and how do you think that will change once most of the population is vaccinated?
That is exactly what we're looking for. And the government has already told us what their plan will be. As we have more individuals become vaccinated, in September, we are looking forward to less restricted travel, meaning that more countries that have their pandemic situation under control will be able to come to Singapore and not necessarily have to do a lengthy quarantine. And also at the same time, we must understand that this is coupled with the increased need for testing. So we need to be open to being tested a bit more often, still be open to wearing masks when you need to in enclosed spaces where are a large number of people, and that really helps with other infectious diseases as well. And, with the travel bit, I think, again, it's more of this at-home quarantine and at-home monitoring and being more mindful of your own personal state and in order to protect the community around you.
So people do have to take responsibility as well. Among that list is Australia on it, and do we have to be vaccinated before we visit Singapore?
I'm not sure what the rule will actually turn out to be. As you know, we haven't had a lot of success in recent months with any sort of air travel bubble. And what I would love to see is having the whole world be part of one travel bubble once again, but we're not quite there yet. So what we want to see is that vaccination programs are increasingly being rolled out. The uptake rates are increasing. So yes, as a public health scientist, I would love to see more people become vaccinated so we can welcome you more readily into Singapore and you can enjoy everything that Singapore has to offer.
We look forward to it, if only. Dr. Hsien-Hsien Lei, thank you so much for talking to us tonight.
Thank you.